day, ma'am. I'm Carl Japete Sabanero. So for today's video, I'm going to show you my return demonstration on communicable disease technique. For the definition, infection control includes all the practices used to prevent the spread microorganisms that could use disease in a person. Isolation refers to measures designed to prevent the spread of infections or potentially infectious microorganisms to health personnel, clients, and visitors. For the purpose, prevent spread of microorganisms from the nurse to the patient, prevent contaminations of the nurse's clothing from the patient, reduce the number of resident and transient bacteria from the hands, prevent transfer of microorganisms from the hospital environment to the patient and from the patient to the hospital personnel, to prevent any accidental contact of a substance that could carry a blood-borne pathogen with small breaks in the skin. So let's go for the implementation. So first, don't forget to wash your hands. Putting on of mask, gowns, and gloves. Grasp gown by collar, allowing it to unfold. Then place arms through sleeves and pull gown over shoulders. Then fasten neckties, overlap the gown at the back, and fasten waist ties. Then position mask over mouth and nose. Bend the mask nose bar over the bridge of your nose. If you are using a mask with string ties, tie the top strings around your neck and the bottom string and around your head. Then take clean gloves and do open gloving. Slip fingers into the opening and pull gloves up to gown wristlets. Repeat this with the second glove. So next, removing contaminated gloves, gown, and mask. Remove gloves by pulling them over your wrist and fingers until each glove is turned inside out. Untie waist ties and let hang freely. Then untie neckties and let gown fall forward off of your shoulder. Slide arms out of the gown working from the inside. Holding your gown away from your body, and fold contaminated side of gown toward the inside. Discard gown if it is disposable. If gown is reusable, hang it in the appropriate place. Then remove and discard mask. Wash hands after leaving the room. Next is transporting patient outside the room. Explain the procedure to the patient. If patient is being transported from a respiratory isolation room, tell him to wear a mask for the entire time the patient is out of the isolation room. Then help the patient into transport vehicle. Cover the patient from shoulder down with a sheet. Then tell the receiving department what type of isolation the patient will need and what precautions the hospital personnel should follow with the patient. When the patient returns to the original isolation room, help him or her into the bed. Cover the transportation vehicle with a clean sheet and remove it from the room. Then instruct all hospital personnel to wash their hands before leaving the area. After that, clean the transportation vehicle with an antimicrobial agent. So for the evaluation, inspect hands and nails for cleanliness. Ask client to explain risk for infection based on the condition. Determine whether the goal of preventing or reducing infection are achieved. Evaluate the comfortable patient after the procedure, then evaluate the effectiveness of the technique towards the patient. For the documentation, document the procedure performed and the reaction of the patient.